My name is Debbie Gentile. I live here in Panama City Beach. I am a teacher at Breakfast Point Academy. I teach children with special needs. I was born and raised in the Daytona Beach area. I was born in September of 1975. My mother was so excited to have a baby girl. She was sure that I was going to be a boy, that she didn't even bring a dress to the hospital. And when I was born, she was thrilled to death that I was a girl. And at my birth, I was a beautiful, healthy baby girl. At my 1-month checkup, the pediatrician told my mom that he detected a heart murmur. When I was 3 months old, my mother had an appointment with the cardiologist. On the morning of that appointment, I woke up with raspy breath. So she called our pediatrician, and he said, well, I'll see you later at the cardiologist. We'll check her out there. When I arrived at the cardiologist, they recognized right away that my heart rate was far above what it should be, and I was rushed to the emergency room. It was there that it was determined that I had a significant ventricular septal defect, which was described to my mom as a hole in the heart. So when I was 4 years old, it was determined that the hole was not closing on its own as hoped, and it would have to be corrected surgically. So we were sent to a hospital in Central Florida to have surgery done. This was in the late 70s, so it was a pretty intensive surgery. At the time, they removed my heart and sewed a Teflon patch over the hole. I have only a few memories of that time, but I do remember having the chest x-rays and drinking the barium and standing with my bare feet on this cold metal floor to have those x-rays done. And I remember the surgery and my recovery. Just 3 days after my surgery, I was running through the hallways dragging my IV pole behind me. I was the happiest, healthiest little girl, never had an issue. I had a wonderful childhood, and the doctors were never concerned again about my heart. It was perfect. After 5 years of marriage, I found out that we were pregnant with a baby girl. We were over the moon. He wanted a girl as much as I did, so we were very excited. Chloe was born on November 16, 2005 in Bangor, Maine. On her first day of life, her pediatrician came to us to tell us that he heard an abnormality in her heart rate, and he felt like she had a murmur. He recommended that we take her to the pediatric cardiologist right away, which of course we did. So at her first week of life, we learned that she also had a ventricular septal defect. Thankfully, hers was much smaller than mine, and the doctors felt confident that it would close on its own. For her first 2 years of life, we went every 6 months to have it monitored, and we were very happy to hear at 2 years old that they had determined that her holes had closed on their own and that her heart was healthy with no further issues. My earliest memories are of drinking barium and standing in front of an x-ray machine, and when I learned that Chloe also had the same defect, I just imagined us going through those same experiences. And our first trip to the pediatric cardiologist with her was such a relief, because the advancement of technology is just amazing. She didn't have to drink barium. She could lie on a comfortable bed and watch a cartoon, and it was such a less traumatic experience for her. And we could see the images on the screen, and these are things that my mom was never afforded when I was going through the experience. And I know those things are possible through the funding and research of the American Heart Association.
That they've done really good, and they've helped a lot of patients, and they have done a really good job.
I can't thank the donors enough for their support because I know that I wouldn't be sitting here today without that support, and my daughter would have had a very different experience.